Thanks for joining us today. It's Thursday at 4 o'clock for Aeroscope television. And today our segment is going to be on what's the difference between Aeroscope and traditional forms of fat removal, including traditional liposuction, laser lipo, smart lipo, etc. So what's the difference between Aeroscope and those forms of fat removal? Number one. Number two is revisions. So let's say you've had something done before somewhere else and you're not happy. We see that quite a bit. I'd say maybe about 30 or 40% of our patients have actually had something done elsewhere and come to us because this is all we do, and they learn about Aeroscope technology and they want to have that to fix it. So we're going to actually meet Amy, who was done at our Tyson's Corner office in Washington, D.C., and she's going to go over her experience with her revision, and then we're going to answer revision questions. But before that, last week we did a patient named Bonnie, and we did her chin, and we want to show some chin results. So just like we always do every week, we're going to show results from last week. So what you can see here is, over there is Bonnie before. And we're going to put this all on Instagram, and you can't see her chin that well. But there we go, Bonnie before, and then Bonnie 1 hour after is right above my head. And I mean, come on. So if anyone could show me anything like that anywhere else, I'd love to know about it. But you see that smile on her face? That is 1 hour after Aeroscope. And then we have 1 week after Aeroscope, right here where I'm pointing right now, where that arrow is. And I mean, I'm so thrilled, and Bonnie is so happy. She couldn't wait to share these with us. But we're going to post these. I want to reiterate to everybody, 1 hour, 1 week is not your result. In three weeks, better. In 3 months for a chin, that's pretty much all it takes to get your full result. Some areas, bigger areas, could take up to 6 months for your full result. But that doesn't matter because you're already happy, like very, very quickly. That's what a really important thing about Aeroscope is, how quickly you see results. You actually see instant results. Those are not your full results, but you see results. So typically full results take 3 to 6 months, including the skin tightening. But as you can see, Bonnie has wonderful skin tightening in 1 week. So Aeroscope has very fast results, much faster than anything I personally have ever witnessed. So what we're going to do is now we're going to go back to Amy, and we're going to show a video that she took for herself and posted on her Instagram for her followers, so we can learn about her revision journey. So revision meaning she had traditional liposuction done, and she was very unhappy with it. She found out about Aeroscope, and let's see what happened.
Like right here, all of that fat pocket that was here, that huge pocket, is just gone. Oh my God, I love it. Oh, I love it. It looks so good. I didn't think I was gonna cry like this. It looks so good. I just can't believe it.
Okay, so that was Bonnie looking at her new arms for the first time after 1 week. So as you can see, she still had her marker on her. So that was very fresh. Amy, I'm sure you're watching this right now because we're about to go live. Your results are going to get much, 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 much better. This is only the tip of the iceberg. 1 week does not a result make. Let's go live with Amy in Baltimore. Amy, let's see.
Hi.
Hey, Amy. How you doing?
Good. It's funny to watch yourself cry.
Isn't it though?
Yeah.
thank you so much for sharing your experience with us and our followers. We're really honored to have you, and it's really so important for people to understand. I could talk until I'm blue in the face, but what you say, what you see, and what you say in your experience is so much more valuable than anything I can ever say. So what I want to ask you about is, first of all, tell us, you had traditional liposuction done on your arms. Tell us about that.
Yeah, so I had traditional liposuction done. Unfortunately, they left me with a lot of fat pockets. But the biggest difference, I would say, is just the recovery time with Air Sculpt was insanely fast. Normal lipo was so painful to recover from and just took forever to get better.
And did they put you to sleep for your liposuction?
So I had lipo 360 and my arms done, and I was totally out for that. So you have no idea what's going on until you wake up.
Yeah, I don't believe in that at all. And with Aeroscope, were you awake?
Yes, I loved it. I was watching the fat come out, and I kept saying, "Suck me dry! Oh my god! Oh my god!" Like I was talking the whole time.
Okay, that's great. And what music did you listen to?
I think we just put on top 40.
Okay, all right.
I talk a lot, so I wasn't really listening to the music.
And you got done at our Tyson's Corner office in Washington, D.C. What was that like?
It was great. The office is really beautiful, really clean, upscale. They did a really good job with just, obviously, when you're getting surgery right now, COVID's a concern. So it was really nice, all the protocols they had in place, and it was fabulous. I loved it.
Thank you so much. Okay, so we're going to just go through some questions that our followers and patients had for you. So how did you hear about Aeroscope?
So obviously I was unhappy with my lipo, very insecure. I'd been looking for a solution for over a year, and I came across you guys on Instagram and was blown away with what I saw.
Thank you. And what about your result from traditional did you not like?
So essentially I had a huge fat pocket here under the arm, under the elbow, and a very big indentation here on the arm. So it just, I mean, my arms looked deformed. They didn't look normal. While they might have been a little bit smaller, I was not comfortable wearing. I would have never worn this on camera or in public.
I love that. Okay. Yeah, I see we do so many arm revisions. I'd say at least 30 to 40% of all AirSculpt patients had something done somewhere else and then find us and we fix it. So I love when someone doesn't wear a tank top, doesn't want to wear a tank top, and then they do, especially on camera. That's the biggest compliment we could ever get. And what did Aeroscope feel like compared to the traditional liposuction experience?
So Air Sculpt, I would say that obviously there's some soreness in the beginning. That's going to be a given, but nothing compared to traditional. With traditional lipo, I was leaking fluids for a whole 7 days. Very painful. I had huge swelling in my hands and stuff. I didn't have any of that. I, had some fluids come out for 2 days. It was a little stiff and stuff, but it was nothing like before. Like I tell everyone, you guys don't get it.
They don't. That's why we do this show. What about your scar? So I want to see your Aeroscope scar, but what was your scar like from traditional lipo?
So it's hard to see it now, but it was here, but it was probably the size of like a pea, I would say. So versus the Air Sculpt one is like, I don't even know where it is. It's a tiny, the dot is so little.
Oh, I love that.
Yeah, that's the Air Sculpt one. And my other one, it's been over a year, so I can't see it, but you can kind of see here. It was a big dot.
I mean, wait a second. It's been 1 month and you can barely even find your entry.
I know.
That's what this is all about. It's supposed to be something where we actually exceed your expectations and it's not a big deal. I want it to be kind of like getting your teeth whitened or something like that, but you're skinnier, or going to the spa and coming out skinnier. So did Aeroscope hurt?
When I was getting it done?
Yeah.
No, not at all. I think it feels a little weird at first because something's going on, but there's no pain. It's more like just a pressure that you feel. Mm-hmm. But then even after that, you don't feel it anymore.
I'm so happy to hear that. And How about the garment? How was that? You wear that for 2 weeks?
Yeah, and that was awesome because with my standard lipo that I got, or my traditional where I did my 360 in my arms, I had to wear a garment for 3 months. So the fact I only had to wear it for 2 weeks was easy breezy to me.
Yeah, that's part of the whole thing. Is this is a lifestyle procedure. I want people to move on with their life. I want them to have a better result than they could ever hope for. But like, it shouldn't be a big deal. Tell us about your thighs, by the way. Your thighs are fresh. We did those fresh, right?
Yes. Yes.
And
I actually wasn't even looking to do that until I decided to my arms and said, hey, I'm going to be in there. Why not? But for me, my thighs rubbed together really bad and would give me bad like chafing all the time. And I was just very subconscious to wear shorts or anything like that. So I loved it. Like, I actually almost like it more than my arms. I'm like, I didn't realize how big of a difference it would give to my overall like aesthetic and shape.
I love thighs. Let me ask you this. And how is your result thus far?
Oh, so good. Everyone that sees me is like, wait, what the heck? What's going on? Did you lose like 30 pounds? Like, what's going on? Like, something's different.
And are they smooth?
Oh yeah, very smooth. I have no lumps and bumps at all. I was surprised at that. I thought it was going to have some fibrosis and stuff in there, but it's very smooth. I would say I had a little bit of discoloration, but after about 3 weeks, that was gone.
Okay. And the lumpy, bumpy stuff you had going on with your arms, were we able to smooth that out?
Yes. And that I had really bad scar tissue and stuff all in my arms. So that definitely was smoothed out. So I can't even believe how smooth you got it with how much scar tissue that I had in there, because it was bad.
Aeroscope is so good for revisions because we can literally power buff that scar tissue out. And it is so hard to deal with scar tissue as a surgeon, but when you have basically a robotic tool where I can point it and just smooth it out robotically, it makes all the difference in the world. And, you know, sometimes at some offices, about 50% of our patients are getting revisions, actually. But I'll talk about that after your interview. What do you plan to do with this new body?
You mean, what am I already doing with this new body?
Oh, well, tell us. Yeah.
Lots of pool parties.
Good.
Pool parties, swimsuits, and I've been buying a lot of strapless dresses.
I'm so happy. It's so great for us to be able to put a smile on your face. It makes it. That's what we're all about, really. Let's see. A couple other questions. When you first heard about Aeroscope, did you think there were multiple sessions you were going to have to do?
I didn't think there were going to have to be multiple sessions necessarily, but I was definitely, well, I say, yeah, being awake. A lot of times when you hear about being awake with any type of lipo, they usually say they can only do one area at a time. So I was impressed with the amount of fat that you guys can remove in a single session, because I was a little skeptical at first. But then when I saw up to 5 liters, I was like, this is the real deal.
The real deal. So everybody watching, there's no sessions. It's one and done. And how many liters did we get out from your arms and thighs?
3.
That is profound. 3 liters is legit.
When I did my whole midsection body and my arms, I had 4 removed. So the fact that 3 was removed from just arms and thighs, inner thighs, is crazy.
That's a lot of people worry that with Aeroscope they're not going to be able to get as much fat out as they could with other procedures. The truth is because you're awake, because it's so minimally invasive, we really go for the gold. So when we do an area, we want to do it right the first time and take out almost all your fat. We purposely leave a little bit of fat, or else you get what's called skeletonized, which no one wants. So that's how you get major fibrosis. So we do less than that, but we actually take out all your fat. So that's part of the philosophy of this company, and the philosophy of Aeroscope is doing it right the first time and going for the maximum fat removal. And everyone's always worried about this 5-liter thing. This whole 5-liter thing never worries us, because if you have more than 5 liters, then we just have you come the next week for more areas. You know, so let's say there was more than 5 liters in your arms and your thighs, well, we do your arms one week and your thighs the next, and we have no problem at all. We'll take out all the fat.
That's a lot. That's a lot.
Yeah. Okay. And why would you suggest AirScope to people who are watching?
I would say that it comes down to recovery and pain. So with the recovery, it's so much faster and you don't have to spend all the money on all the post-op massages and months of not being able to do anything. So definitely recovery. And also for me, a big thing was the precision of it. And like, I know, for example, like the side of your arm here, I had a really big bulge and no one would touch it. I got 8 different consults for arm revisions and everyone's like, we won't touch that. And when I went into you guys, they're like, yeah, no problem, we can do it. And that has slendered my whole look so much from this outside piece here. I love it.
I'm so happy. This is great. I mean, this is all we do. And that's something that everyone watching needs to understand is we only do one thing and this is it. So we've seen everything. So you're like a very bread and butter standard patient for us. And this is what we do, guys, every day, every office. Anything else you want to tell people who are watching?
I would just say that obviously if you're looking into liposuction or any type of treatment, look into Air Sculpt first, because coming back into scar tissue is always going to be more difficult than if you just start with the right procedure. And make sure you get lots of before and after examples of whatever area you want to do so you know you'll be happy. It's all about expectations. I
totally agree. Thank you, Amy. Again, we're really honored to have you, and thanks so much for getting AirScope. It's such a compliment. Yeah. I really appreciate it.
Absolutely.
Okay.
Thank you.
Thank you. All right. Bye-bye. So that was Amy's experience. Now what we're going to do is we're going to talk about the differences. We get a lot of questions about what are the differences between traditional forms of fat removal and Aeroscope. So we're going to go over them a little bit. But what Amy said is the most important difference, which is speed of recovery, which is almost 24 hours or less. And as you can see with Bonnie's chin, instant results, not your full result, but you actually start seeing results. Also, far, far less pain, doesn't interrupt your lifestyle. You can go right back to work. Those are all wonderful things. Smoother results, much smoother. The ability to fix results you have that you're unhappy with, that's a huge thing. But let's talk about it in a little bit more detail. So with AirSculpt, there's no needle, no scalpel, no stitches, and of course, you're awake. Everyone is always awake. No one is ever put to sleep. We get asked that a lot. Can you be put to sleep for AirSculpt? No, you can't. So we wouldn't do that. I don't think it's the right thing to do for anybody. So I want you to enjoy the experience. I want it to be like a surgical amusement park ride. And that's it. Okay, I want you to have a good time. One of the questions we got is, can you bring a friend in the room? Absolutely, we encourage you to bring a friend in the room because it's fun. It's like, do you want to go to the spa with your friend? Yes, you do. So it's good company, it's someone to hold your hand, it's someone to DJ the music. I want you to have a good time. It really doesn't hurt, as you could hear. Amy told you that, it felt weird at first and then it didn't hurt at all. So, and that's what just about everybody says. So that's a really, really important thing. But what I care about as the surgeon and the developer of AirSculpt is I want you to get better results than you can get with anything else. And why does AirSculpt give you better results? Well, it's basically robotic. Here are your options. You could move your hand as fast as you can like this with a cheese grater. It really is not a good way to sculpt someone. Or you could use a specialized robotic tool where you point it as the surgeon, and wherever you point it, it does a perfect job. Whether that person's had liposuction or some other form of body contouring done before, we can smooth it out, and take out the fat, and make everything even, which we do every single day. That's really, really, really important. So the other thing that we didn't really cover with Amy is that the skin tightening. If you look at the arm behind me, look at the skin tightening. So AirSculpt is magical because of that skin tightening. We get a smooth result, We get a fast result. It's as painless as we could possibly make it, much more pain-free than any other surgical form of fat removal. But more than that, besides that great clean out that we can give you, we can tighten your skin at the same time. And that's really important because we've had a lot of patients have things done where they got out the fat, but then they come to us with loose skin. We cannot just make your skin tight with Aeroscope. We have to do it right the first time. So that's a really important concept for today's show is you only have one body. Do it right the first time, right? Sure, we can help you. We can do revisions. It's probably 40% of our people, our patients who come in, but really, this is an important choice. Do your research, and you want your skin tightened. You want to be awake, and you want to be able to go back to your normal life as soon as possible. You don't want to wear a garment for 6 months. You don't want to have to go get massages. You wear our special Spanx that I created for just 2 weeks, and you move on with your life. As you can see with Amy, she couldn't even find her scar after 1 month. So with traditional liposuction, you typically have a scalpel and you have stitches. Sometimes you even have drains. We don't have any of those things. No needle, no scalpel, no stitches. So let's go over some more things that are important. And that is the downtime shorter than traditional liposuction? The answer is much, much shorter. Most of our patients are back to normal life in 24 hours. Usually we say you can't work out for 2 weeks, and you have to wear the garment for 2 weeks, but you have to walk at least 45 minutes a day, starting the next day. So you also have to eat breakfast. You don't have to fast before the procedure or not have water in the morning or not have your morning coffee. It's a normal day. Let's see. We talked about skin tightening. And will my fat return after getting Air Sculpt? Someone wrote into us and said they had traditional liposuction and their fat came right back. So no, with Air Sculpt, because this is an advanced procedure, the fat is really removed. You see it in a bucket and we remove it smoothly. What happens a lot with traditional liposuction is the fat that's removed isn't coming back, but they don't take all the fat and you don't get a thorough cleanup. And that's really, really important. If you have a problem area, you want it to be over with. I want you to come in and leave in an hour and have it done. I don't want you to have to worry about it. You know, I feel terrible for what Amy went through, and I don't want any of our patients to go through that. So, no, Aeroscope, when the fat is out, it's out. Let's see. I've seen traditional liposuction give bumpy lumps. Will Aeroscope fix this? Yes, it will. And can we give you a smooth finish? Smoothness is key, and that's why you want to use Aeroscope over traditional liposuction or any other form of surgical fat removal because it's manual. No one can do this that fast. It's really not, in my opinion, not the best possible way to do it. And remember, you only have one body. You've got one good opportunity to do it right. Can we fix it? Yes, we can make it better, but we'd rather do it right the first time. What does the scar look like after Aeroscope? As you could see with Amy, it's extremely small. She couldn't find it. What I show on every episode is the hole is only that big, literally. That is the tool we use. It's the size of your average freckle. So even if you have hyperpigmentation, it's okay. You have a new freckle. How much fat can you take with Aeroscope compared to regular liposuction? The same amount. It's state law. They don't care if it's traditional liposuction or whatever you want to call it, or if it's Aeroscope, but it's the same rules apply. It's 5 liters. Some states are different, but since we're in so many states, we do 5 liters. It doesn't matter though. That's never a limitation because if you have more than 5 liters, then we separate you into different weeks. So 1 week you get your arms and thighs done. Another week you get your tummy done. It's not a limitation at all. So, and I think it actually increases your safety. So we would never go over that. I would never want to do anything to any patient I wouldn't want to do to my own family. And 5 liters is quite a bit. I always show the 5-liter log. This is a lot of fat, guys. Okay, this is 1 gallon. That's enough for one time, I promise. So that's important. Some more questions. Let's keep going. Most liposuction places I go to have a BMI or weight requirement. Are there requirements with Aeroscope and Elite Biosculpture? No. We have no weight requirement. We have no BMI maximum or minimum. We're here to take out unwanted fat. If you can pinch it, we can take it. So that's really, really important. We're not here to judge whether you're too skinny or if you think you're too big. No one is too small or too big for us. We're here to remove unwanted fat, period. So if you can pinch it, we can take it. It's that simple. Let's see. Are you able to treat more than one area during your procedure? Yes. We treat up to 5 areas at a time. When we do a BBL, it's about 5 areas. But we separate you out to make sure, depending on the patient, that we don't take out more than 5 liters. So that's really, really important. Someone said, after being botched by traditional liposuction, how long do I have to wait to get corrected by Aeroscope? Great question. The answer is 3 to 6 months. It depends on your swelling and it depends on the area. So there's been injectable forms of fat removal where we're able to revise it very quickly. The more damage that was done, the longer we have to wait because we need things to settle down so we know what we're working with. But the answer is about 3 to 6 months. If you're unhappy with something that was done at another practice or with another doctor, we can fix it. Someone asked the question, can you fix my Kybella chin with Aeroscope? The answer to that question is yes, we sure can. So having an injectable form of fat removal does not stop us from being able to revise it if you're not happy. And that's pretty much it. So any other questions, Lauren, for us while we're live here?
Although you already showed the entry point, someone is asking, if there is no needles, how do you guys, make the entry point?
So this is a biopsy punch. It is not a needle. It's a tiny microscopic cookie cutter. And that's how we get into your body and get into what's called your fat plane, the area of your body where the fat is. And then Aeroscope goes in that hole. It numbs you, and then it removes your fat cell by cell, like plucking berries off a bush. Instead of scraping flesh, muscle, and skin out of you like a large diameter cannula would do, we use the thinnest possible cannula to actually get your fat out. Any other questions, Laura?
Someone heard that traditional liposuction, tears at the muscles. Aeroscope does not touch the muscles, correct?
Correct. Aeroscope does not touch your muscle. When you get your muscle touched, that causes prolonged soreness and pain. Because you're awake, we know if we're anywhere near your muscle because it would hurt.
That's all we have for today.
Okay. Thanks so much for watching again, everyone. We really appreciate the opportunity to chat with you and teach you about Aeroscope and interview our patients. So thanks again, and I hope to see you next week.